thank you for the great work that you do here. As the healthcare screening match continues, this gives us an opportunity to talk about what's really important toward the goal of delivering high-quality healthcare services at the lowest possible cost. In order to do that, you have to have the tools of collaboration, because the biggest problem in our healthcare system today is that care is highly fragmented. People are doing their own thing, which leads to a lot of waste and overutilization in the healthcare system, which drives up the cost of healthcare. So what are we trying to do? We're trying to get away from a fee-for-service mode of reimbursement for healthcare and encourage healthcare providers to collaborate toward what? The total care of the patient. This results in the highest quality healthcare at the lowest possible cost. In the debate that you hear going on throughout the nation, people talk about a European style. They talk about a Canadian style. What we have here is a uniquely American style, and a uniquely American problem that has a uniquely American solution. It's found in places like the Cleveland Clinic, like the Mayo Clinic, like Johns Hopkins, places that are not for profit, where overutilization does not occur, because whether you do one procedure a month if you're a physician or 10, you're paid the same. The financial incentive is in keeping people healthy so that they don't have to enter the healthcare system as frequently, thus driving down costs. It's very, very important. And that's why this money for electronic medical records is so vitally important, because you can't collaborate unless you have a tool to collaborate. Right here at Northwest, providing excellent quality healthcare services, you have access to a primary care physician. Another problem, that's why insurance is important for people. See, what the American people and the people of Western New York need to understand is whether or not you have health insurance, people are getting health insurance. The problem is they're typically a lot sicker than they otherwise would be. The problem is they're going to emergency rooms to get health care, which is the most expensive health care to administer. Right here at Northwest, you have access to primary care physicians that can help manage your care and help you develop a healthier lifestyle toward the goal of prevention. Because keep in mind that probably 70% of the healthcare dollar goes to treat chronic illnesses that are influenced by lack of exercise, by smoking, by diabetes. Health economists would call this the disease burden. So when you have access to a primary care physician, which is rare in a unique place like this, a clinic, what you're looking after is the overall care of the patient. So this announcement of a $560,000 grant is not really a grant, it's an investment. It's an investment in healthcare reform that the nation can look at this place, this small, humble place, and this humble community as a model, because we're looking to deliver healthcare services more effectively, more cost efficiently, and toward the overall goal of keeping people healthy, and when they're not, finding a way to get them to a specialist if in fact they need it. So Joanne, we congratulate you for all the work that you're doing here, that you have been doing, but more importantly, all the work that you'll be doing in the future to demonstrate to Buffalo and Western New York that right here at Northwest, a community-based organization with a community-based board, they're doing it right in demonstrating to the rest of the region and the rest of the nation that this is the direction we're moving in. It's going to accrue to the benefit of the economy of Western New York. It accrues to the benefit of all the people who will be served here and all of those who will be served here. So Joanne, thank you very much for your leadership. Thank you for the great work that you do, and we look forward to a constructive and informative tour of this great facility and for the almost 9,000 people that are served here. Thank you very much.